So this first talk from me is an introduction to set the stage for immunotherapy by giving some background about the immune system and how immunotherapy is a little different from a normal immune response. So, overall, the immune system protects the body against illness and infection. It's the natural defense system that primarily defends us against infectious disease, viruses, bacteria, and other bugs. And it essentially works by identifying things that are not our cells, that don't belong in your body, and fights them off, and then forms a memory response so that it can fight them more effectively if you subsequently see those same bugs later in life. The immune systems throughout the body originates in a couple of organs like the bone marrow and thymus, but then immune cells are present throughout the body, in the gut, the skin, other organs as well. Next slide, please. So one might ask, why can't the immune system fight infections fight cancer or leukemia by itself? So the immune system is quite good at recognizing cells that don't belong in our body, but it's important to remember that leukemia cells actually develop from our own cells, our own blood cells, and these are developed genetic changes that stop them growing and developing properly and causing them to grow and divide uncontrollably. And those leukemia cells then take over the bone marrow and cause illness. So because the leukemia cells don't arise from our own cells, the immune system could often have difficulty in recognizing leukemia cells as foreign. Or they might see them as foreign but are not active enough to then attack the leukemia cells and eradicate them. In addition, leukemia cells have mechanisms to evade the immune response, to hide in different sites of the body, to further make it difficult for the immune system to attack leukemia. So this is why immunotherapies have been developed to try and address some of these limitations of our normal immune response. Next slide. So, what are immunotherapies? So immunotherapy refers to a group of treatments that help the immune system recognize and attack cancer cells. And all of them are based on the notion that immune cells have special proteins or receptors on their surfaces that allow them to recognize matching proteins called antigens on cells, in this case, leukemia cells. And so each of the different types of immunotherapy are designed to connect the immune cells and leukemia cells by matching these receptors with the antigen present on the leukemia cells. Because of this matching and being a very focused approach, immunotherapy is targeted, and that's its biggest difference from conventional chemotherapy, which kills fast-growing cells. That immunotherapy, by and large, is generally targeted to specific types of cancer cells or leukemia. Next slide. So there are three main types of immunotherapy used to treat ALL. Next, please. The first are bispecific antibodies and mites, and these are proteins that find and attach to cancer cells, and they bring together the leukemia cell with certain types of cell in the immune system, such as T cells, that gets those T cells to come in and attack the leukemia cell. Next. So the next are CAR T cells, or chimeric antigen receptor T cells. These are, as they suggest, a cellular therapy where doctors and scientists take immune cells from the body, typically from patients with leukemia or donor individuals, and then alter them in a laboratory so that they express a very special receptor that make the cells much more effective and specific for attacking leukemia cells. These cells are then infused back into the body and have an anti-tumor effect. Next. And the third type are antibody drug conjugates that involve taking a protein or an antibody, which is a normal part of the immune response, but coupling it to a chemotherapy drug. And so this is a drug that would otherwise be quite toxic, but because it's coupled to the antibody, it's targeted to leukemia cells, and the drug is released when it gets inside the cancer cell. Next, please. So this slide shows and summarizes some of the differences between immunotherapy and chemotherapy. So as mentioned, immunotherapy targets specific antigens that are more common on cancer cells, and often specific for different types of leukemia. And because of this, they attack fewer healthy cells than cancer cells and fewer healthy cells than chemotherapy. In contrast, chemotherapy in general works by killing fast-growing cells in the body. And this exploits the notion that cancer cells generally are fast-growing, but also several other body cell types are fast-growing as well, such as hair and aligning with the state. So chemotherapy is non-targeted, and it's associated in general with more side effects. Next slide. So this slide depicts some of the side effects of immunotherapy. So even though it is more targeted to the cancer cells, it is associated with different side effects. In fact, some of these side effects reflect that the immunotherapy is having its anti-leukemia effects. So in fact, a good sign that the immunotherapy is being effective. These can be very non-specific, such as tiredness or rash or headache, aches and pains. Some of them can be more serious, such as they arise from when the tumor cells are being broken apart. It can cause an inflammatory response. Occasionally, these side effects can be severe, but in general, they can be managed with appropriate treatments to anticipate and control the side effects. Next slide. So what are the potential benefits of immunotherapy? One of the major attractive benefits of immunotherapy is particularly for CAR T-cell therapy. They can have a long-lasting remission that could be durable and last for a period of months or years. They can be effective even in quite advanced disease, relapse or refractory disease that's come back after a non-specific or chemotherapy-based treatment regimens. Then they can target a small amount of residual leukemia cells in the body. And as mentioned, because they target cancer cells somewhat specifically, there is a less damage to normal cells of the body. Next slide, please. So it might be considered for immunotherapy, and Dr. Stock will describe this in much more detail for the individual agents. But this is undergoing somewhat of a change now. But at the moment, the major category of patients who are eligible for immunotherapy are those with relapsed or refractory disease. So that is where initial conventional treatment was used and then the tumor has come back. At the moment, they are approved for patients with the most common type of ALL, that is B-cell precursor ALL, targeting antigens including CD19 and CD22. They are available for patients of all ages, although some immunotherapies are approved for younger individuals, some for older individuals. Again, Dr. Stock will describe that. And patients who are undergoing transplantation. So one of the active areas of research is transplantation. Previously has been used as a main treatment for advanced disease in ALL. Immunotherapy is starting to change the thinking about when transplant is needed. And another major area of investigation is using immunotherapy earlier in treatment, not waiting until the disease comes back, but using it where initially in initial induction or where there's some evidence of persisting disease or measurable residual disease. Next. One important area is T-cell leukemia, which is less common, but historically has been at higher risk of treatment failure at relapse. While there are no approved agents yet for immunotherapy for T-cell leukemia, there are many or multiple immunotherapies for T-cell disease that have shown activity and remission and great promise, and there are a number of trials testing these. Next slide, please. So in summary, the immune system is our natural defense system against bacterial pathogens. The immune system can recognize foreign cells, but because leukemia comes from normal cells, it's harder for our normal immune system to recognize and kill leukemia cells. Immunotherapy exploits the notion that we have receptors targeted to antigens on leukemia cells, and as it's targeted, it's more effective in killing cancer cells and sparing normal cells. There are three main types of immunotherapy. You're about to hear more about these. These are bispecific antibodies, CAR T cells, antibody drug conjugates. There are side effects. They vary according to the type of treatment, but they are generally well controlled with additional medication. And immunotherapy has shown great promise, and its utility is expanding. And a number of studies are testing the role of immunotherapy in different types of leukemia, in particular early in the treatment course.